Hello guys, so welcome to Examdays. In this video, we are going to discuss about MLHP Entrance Examination multiple choice questions, we called as a bits. So this is the fourth video for the continuation of 100 videos of the web series for mid-level health providers. So in this video, so today we are discussing more than 15 questions on this. Let's start today a fourth part. So in the first question in MLHP series, approximate weight of the brain is what? What is the approximate weight of the brain? A 1200 to 1400 grams, B 150 grams, C 250 to 280 grams, D 40 to 70 grams. Your correct answer is option A, 1200 to 1400 grams. The average weight of the brain in adult, especially the male, is going to be 1336 grams. For in female, it's 1198 grams. With increasing age, brain weight decreases by 2.7 grams in males and by 2.2 grams in females every year. So per centimeter, the body has a height brain weight increases depending upon the sex ratio, and which is average about 3.7 grams. So this is the scenario of the weight of the brain. So this is in the picture, it is showing that it is the fundamental view of the brain of both male and female. So moving on to the next question, the largest lobe of cerebral hemisphere is the largest lobe of the cerebral hemisphere is going to be your options: parietal, B temporal, C occipital, D frontal. So the correct answer is option D, frontal. So here is image has given on this screen, which is a reference purpose of the candidate, where they can understand how the question is going to be described and what is the explanation is correctly matched with the question. So frontal lobes are located directly behind the forehead. The frontal lobes are the largest lobes in the human brain, and they are also most common region of injury in a traumatic brain injury. Moving on to the next question. Fibrous connective tissue that covers the brain and the spinal cord is what? A meningitis, B pericardium, C pleura, D peristoeum. The correct answer is going to be A, meningitis. Meninges. So these meninges are 3 layers. So has given is the layer 1, layer 2, layer 3, all these 3 layers. So membranes that covers the protect your brain and the spinal cord. So they are also known as dura mater. So dura mater, this is the outer layer, the closest to the your skull. Argent matter, this is the middle layer, the P matter. This is the inner layer, is the closest to your brain tissue. So this is the issue. The location is showing in terms of in the zooming way. There is a durometer, arcade, and piameter. So this is called a meninges. Moving on to the next question, the sutura between the two parietal bones is option A, frontal, option B, coronal, option C, sagittal, option D, lumboidal. So the correct answer is option C, sagittal. So where the sagittal is, what's meant by sagittal? So vertical plane running from the front to back, divide the body or any its parts of the right. So which is called a left side, as given the information here. Okay. So sagittal are also called the longitudinal plane, where is showing the region over here. Moving on to the next question, which of the following transmit impulse from receptor to CNS? Your options A, afferent neuron, option B, afferent neuron, C, interneuron, and D, multipolar neuron. Your correct answer is going to be option A, afferent neuron. So the explanation is going to be afferent neurons are also called as sensory neurons, and their fibers are responsible for bringing the sensory informations from the outside the wall into the brain. So here is the reference as given image. So here is the retinated nerve, and it is the spinal cord, all the region, and it is the afferent nerve. So here is the outer layer of the skin. So where the sensory informations may involve the spatial senses such as the vision of the area. So it is such as a vision, hearing, smell or taste, as well as the sense of the touch, pain and the temperature. So this is the nerve, as the name has given is afferent. This is afferent nerve. So this the correct answer is going to be afferent nerve. Next question, flexation posture that indicates a severe impairment of the cerebral functioning is A. Your options: option A, decerebrate, option B, decorticate, and option C, ophthalmos, and option D, Trendelenburg. So the correct answer is going to be decorticate. So decorticate posture here is showing here. So this is the absolute posture, that is going to be abnormal posture in the which the person is stiff with the bent arms, clenched fist, and the legs held in the straight. The arms are bent towards the body, and the wrist and the fingers are bent or held into the chest. So this type of posturing is a sign of severe damage in the brain. What is Mustania gravis is diagnosed by A, Rotheria test, B, Thanslia test, C, endophenium hydrochloride test, and D, both B and C. Options is option D, both tensilin as well as endophenium hydrochloride test. So here is the main test for the Mustania gravis is a blood test that took the type of the antibody which is produced by the immune system that stop the signal being sent between the nerve and muscles. This high level of these antibodies usually means you have Mustania gravis. So this is the main important thing. This it will be that antibody will be stopped between the nerve and muscles. So this is the part you have to understand how it's going to be work apart from it. Okay, so both nerve as well as the muscles. Moving on to the next question, X-ray study of a spinal subarachnoid space is termed as a SPECT, and second option is a PET, and option C is cerebral angiography, and option D myelography. So the option is going to be myelography is the X-ray study of the spinal subarachnoid. So here is the explanation as given. Myelogram is a diagnostic. Myelogram is a diagnostic imaging test generally done by the radiologist. So here is the main what is the exact area is affected. So it is uses a contrast dye and X-rays or computed tomography, which is called as the CT, to took problems in the spinal canal. So problems can be developed in the spinal cord, nerve roots, and the other tissues. This test is also called as myelography. Moving on to the next question, what is the therapeutic range of phenotine? So your options is going to be 1.2 to 2 mcg by m1, and B option is 5 to 10 mcg by m1, and C is going to be 10 to 201 mcg, and option D is going to 20 to 30 mcg by al. So the correct answer is going to be 10 to 20, 1 mcg. So this is actually a therapeutic range from the most in adult, which is between there is a ratio 10 to 20 mcg by ml. So for the total phenotane, which is a bound plus unbound, and the 1.0 to 2.0 mcg by ml for the free phenotane, which is unbounded only. Next question is difficulty in speaking, which is also called as, your options A, dysphonagia, and B, dyslexia, C, dysarthria, option D, dyskinesia. So your option is going to be dysarthria. So here is the which will be called as a sign and symptoms, which is a slow and slurred speech or rapid speech that is difficult to understand, or you can say abnormal speech rhythm, or you can say uneven speech volume. So this is the exact information as given for explanation purpose. Moving on to the next question, it's going to be the position suited for the unconscious patient is going to be, the position is suited for the unconscious patient is going to be, your options are fowler position, B, prone position, C, supine position, D, semi-prone position. So the correct answer is going to be semi-prone positioning. So here is the total 6 position as given approximately for the understanding purpose. The position to facilitate vaginal examinations. The patient is lying on ear side and the lower arm of the behind the back. So these things are flexed. Okay. So this upper one is more than the is lower. It's a prone, supine, and right lateral, recombinant, and foral. It's also is given information for just understanding purpose. Moving on to the next question, which is a not change in the CSF value in meningitis. So your option is going to be option A, CSF pressure is elevated, and B, CSF protein is elevated, and C, CSF glucose is elevated, and the option is going to be all of the above. So here is some main thing is glucose is elevated, which is the value does not change in CSF value. So normal level of glucose in the CSF is greater than 50 milligrams by DL to 80 milligrams DL, or 2.5 mmol to L to 4.4 mmol to L. So if your levels are lower, so you may have an infection. So your healthcare provider will look into your CSF glucose level along with the other CSF test. So, and possibly other test, it's better to understand that what your results mean. Moving on to the next question, what is the minimum score in Glasgow coma scale? Is your option C, 1A, 1B, 3, C, 5, D, 5. So okay, here is the option is given twice. Okay, let's say it is a 7. So these are the odd numbers, 1, 3, 5, 7. So your option is going to be, it's a 3, which is a minimum score in the Glasgow coma scale, which is actually each category has a 1, therefore the lowest score is a 3. No response to pain, plus no verbalization, plus no eye opening. So is GCS for the 8 or less indicate that severe injury, which is 1 of 9 to 12 moderate injury. If GCS score is a 13 to 15, which obtained when the injury is minor. Moving on to the next question, what is the late sign of increased ICP? Where your option is going to be systolic hypertension, B, bradycardia, and the papilledema, and C, and the last one is D, headache. So your option is going to be bradycardia is the correct answer for the when the lead sign of increased in ICP. So here is the bleed criteria symptoms, which is easy, so you can say confusion or chest pain or discomfort, or you can say so dyspnea, which is also called as a shorten of your breath. Okay, so this is the slow heart rate, the heart rate, the hearts of the adult at rest usually beat between the 60 to 100 times of the minute. If you have a bradycardia, so your heart beat fewer than 60 times per minute. Moving on to the next question, what is the recommended fluid restriction of increased in ICP? So your action is going to be 1000 ml per day, B 1200 ml per day, C 1500 ml per day, and D 2000 ml per day. Your correct answer is going to be option. So you can say option B, it's 1200 ml per day. Here is the explanation as given. What is the etymology when increased in the ICP? So it is a too much cerebral fluid as well as the fluid around the brain meningitis. When the tumor is begin or malignant, bleeding to the brain and swelling in the brain and high BP. So this is all the information regarding the fourth part. So guys, so that's all for today. And so if any questions, if any options are wrong, just use the below comment section. You have to type with the question and the options and express your suggestions while continuing this MLHP questions. So whatever ideas and topics and suggestions, okay, just use the below comment section. Just pass your ideas and suggestions, and also post your some topics so that we will discuss on certain topics only. Okay, so guys, you can download this PDF sheet. The link is available on the description box. Use the link and you can download direct PDF in your mobile or laptop or system. So guys, that's all for today. Like the video, share the video, and don't forget to subscribe to Examdays TSAP for regular updates on MLHP examinations. Thank you.